doesn't really spend much on healthcare. Don't be fooled by that number over there. Nearly $3 billion was spent on healthcare in the 2012-2013 fiscal year. That's the one we have the most recent national health accounts for. Now, a lot of that money comes in from private sources, so medical insurance companies, household savings, personal income, that sort of thing. It accounted for about 40% of total health expenditure in that fiscal year. Public sector sources, government mainly, that provided about 34%. The remainder, however, came in from other taxpayers elsewhere in the world as donations from their respective governments. China, the EU, the US, you name it. The thing is, though, don't let the private sector shares of funding fool you. More often than not, health expenditure is a catastrophic event that tends to push families into poverty, and that's why you've got a lot of fundraising events known as Harambees over here that are so common. Now, let's get back to that private sector side of funding. The insurance side is a very, very tough business. The country has roughly 19 or so privately owned and run medical insurance providers, but this is a highly concentrated industry. You see, of the $288 million in medical insurance premiums paid in 2015, over 60% of those went into just 4 companies: Jubilee, AAR, UAP and Resolution Insurance. Of the 19 medical insurance providers, just 42% made an underwriting profit. The remainder, at nearly 2/3, lost money in medical insurance. The sector as a whole actually lost $3 million in underwriting losses in 2015. So, whichever way you look at it, especially by the numbers, the state of healthcare in East Africa's biggest economy is anything but healthy.